What do liver cirrhosis, fatty liver, and tumors look like on CORT scans? Imagine peering inside the body to see how the liver is doing without any cuts or needles. That's what a CORT scan offers. It provides detailed images that help doctors spot liver problems like cirrhosis, fatty liver, and tumors. Each condition has its own telltale signs on these scans, making diagnosis more accurate and guiding treatment plans. When it comes to liver cirrhosis, the scan shows a liver that looks quite different from a healthy one. Instead of a smooth surface, the outer edge appears irregular or bumpy, like a rough coastline. The liver itself may be smaller than normal, especially in advanced stages, because scar tissue replaces healthy tissue. The tissue may look uneven in density, with some areas appearing darker or lighter, reflecting scarring and regenerative nodules. Doctors also look for signs of portal hypertension, which often accompanies cirrhosis. This includes an enlarged spleen, known as splenomegaly, and fluid buildup in the abdomen called ascites, which shows up as dark, hypodense areas. Blood vessels around the liver may be widened or abnormal, indicating increased pressure in the portal vein system. These features help radiologists identify cirrhosis and assess its severity. Fatty liver, also called hepatic steatosis, appears quite differently on a CORT scan. The key feature is decreased liver density. Because fat is less dense than liver cells, the liver looks darker or hypodense compared to normal tissue. Usually, a healthy liver is denser than the spleen, but in fatty liver, the liver may appear less dense than the spleen itself. Fat can be spread evenly throughout the liver or appear in patches, giving a diffuse or patchy pattern. Importantly, fatty liver does not cause distortion of the liver shape or displacement of blood vessels, which helps distinguish it from tumors. No mass effect or irregular borders are seen, making fatty liver a more uniform appearance on imaging. Liver tumors, whether benign or malignant, present as abnormal masses or nodules within the liver tissue. The most common malignant tumor is hepatocellular carcinoma, which often develops in a cirrhotic liver. On a CORT scan, tumors may stand out because they are denser or less dense than surrounding tissue depending on the phase of contrast used. In the arterial phase, malignant tumors like hepatocellular carcinoma often show increased blood flow, making them appear bright or hypervascular. Later, in the venous or delayed phase, these tumors tend to wash out, appearing darker than the surrounding tissue. This contrast pattern is a hallmark of hepatocellular carcinoma. Tumors can have irregular, uneven borders and vary greatly in size, from tiny nodules to large masses. Benign tumors, such as hemangiomas or adenomas, usually look more uniform and well-defined, without the characteristic contrast enhancement seen in malignant ones. Using CORT scans in liver disease helps doctors detect problems early, especially in patients at high risk. It allows them to monitor how the disease progresses or responds to treatment. When necessary, CORT images guide biopsies or other procedures to get a tissue sample for confirmation. Differentiating between benign and malignant lesions is crucial for planning the right treatment. Remember, interpreting these images requires expertise from a radiologist, who considers the clinical history, lab results, and sometimes additional imaging or biopsy results. Always consult healthcare professionals for an accurate diagnosis and personalized care. CORT scans are powerful tools that, when used correctly, can provide vital insights into liver health and help guide effective management.